Be bashful.
Maggie, you're okay.
You want to show some more of the, we can kind of have people rotate. I can show some more of the mobilization. You can do more of the massage. And,
Sure, can do that.
Right.
Perfect,
Hello.
thank you.
We can use this room back here too if y'all just got a bed in it.
Okay, yeah, I'm all down with
We'll
that.
take Gracie in. Sure.
a
And
lot
we'll
more
rotate through.
comfortable. Gracie, come on, Gracie.
Give you a minute to kind of get comfortable with the dogs in front of you, right?
I'm not here.
Say
Yeah,
hi.
throw on our left
They're all
side,
pretty
I
flexible,
guess, and-
obviously, if we're using them in labs,
And,
but getting the idea of
yeah.
what's going on.
come on, Gracie. There we go.
Okay. Hey, kiddo, what are you doing? She's like, I'm just going to stare on camera because I'm awesome. Are you happy? Are you happy?
Pretty happy.
She's like, no, I'm just naturally this awesome.
Grace,
She another Grace?
I think so.
Yep, she's Grace. Hi, Grace.
Sweetie.
So one of the ones, I like to palpate them, right? We talked about in a standing position, in a sitting one as well, and then I'll feel them again, right? But kind of coming down, what I'm just quickly feeling for is muscle symmetry, right? We're going to assume she's pretty normal. Kind of come down, and I'm just going to press at the shoulder joints. And everything's passive, right? I'm not doing anything major right now. Feeling her elbows, are they symmetrical? Are the joints effused all coming down her wrists, coming down her bones, right? Feeling through, she's like, yeah, I'm pretty good at this, okay? But what I thought we'd do is, come here, kiddo, can you lay down? Oh, good job.
Good girl.
So it depends on position, right? We always want to have someone at their head. She's obviously pretty chill, right? But what I like to start with them after we've kind of gotten them used to is just kind of feeling, right? So part of it is diagnostic, right? And just going through and see if there's anything that I want to avoid or come back to later, is be aware of, right? But when we're talking about shoulder massage, first I want to see is, I've got pretty good flexion, okay? And I'm pretty happy with extension, okay? All right, and she's not uncomfortable there, right? And part of this as far as palpation, right? So here's spine of the scapula, coming down. I can drop my finger directly into her shoulder joint, right? And I can rotate out the greater tubercle and feel her pretty easily. So she's an easy one to feel, okay?
She's a little on the thin side.
Yep, right? And when I work on these, I start up at the scapula itself, and I like to work around, because I find that they really get tight. Everybody kind of focuses on the joints. Really easy to focus on the shoulder joint. See what the whole scapula is doing, because it'll adhere down to their thorax, and they can't move it.
In a lot of older dogs in general.
So I just like to see, can we kind of move them through a little bit, right? I'm still kind of gliding with my effleurage, right? And just kind of getting in, and all of a sudden it's very easy to kind of drop in. Think about the big muscles that are working here. It's through the triceps, right? Coming down, right? And think about coming back up too, but I like to be in a position where I can use my hands and then come back up, right? And this allows me, if I have to multitask, easygoing dog, she's not going much anywhere, but if she does, left hand here, granted, right, my wingspan's a little bit different than others, but I can work really into the shoulder, okay? But I'm working on the scapula, the shoulder joint itself, and the top of the humerus. Extend elbow, right? And you get two. You get supraspinatus first, biceps second.
That's what can I put my finger
Sure.
on the supraspinatus? That's there. I know the biceps. I can always find the biceps tendon, but I always have trouble with that, or maybe it's because the dogs are a little too heavy.
Yeah.
Okay.
And then the quick test, go ahead and feel. All right, so you can come right off the acromion, supra, biceps. Right? And they'll run almost parallel to each other.
Why am I only feeling one pop
see.
through? It's okay,
There's
girlfriend.
one, kind of fall onto one, and then you fall over to the other.
Oh, okay.
Okay? You have to start somewhere. It's not gonna. There's not a zero. Can feel? and she's pretty easy about stuff, right? And then work through those areas. And I kind of want to see the other one I want to check for real quick. We can rotate the greater tubercle out laterally, but she doesn't, not going to get a pop, and she's not going to, when their elbow comes from here to here, they have shoulder instability, right? Knowing that shouldn't be happening. So I'm pretty comfortable, but I'm not bringing her out. So why don't you guys work a little bit through that area with her for me, and then go check on the other group. Yep. Which way did you start? Did you start in there?
Why don't you follow me and then we'll just keep going in circles.
That works? You guys got the closed room?
Yeah, we're closing everybody up.
Yeah.
Just a different
So,
mindset.
I'm going to, if I palpate the spine of the scapula, there's the acromion right there, and then I go down to the joint space. So if I have one hand on the acromion and one on the greater tubercle, and then I do for example, a cranial glide, I'm kind of looking at how much my hands are moving. So there's they are at rest. And then when I do a grade 3, I'm pushing the head of the humerus cranially there. So my hands are on the bones. That's into that part of the capsule. That would be a grade 4. And a grade 3 would be on and off. So I'm palpating acromion and tubercle, so I can see where they are at rest, and then see how much you've taken up that slack before you oscillate. So that would be an accessory grade 4. And then you can also do that longitudinal distraction. There's the acromion, just come down to the humerus. That's distracting the whole joint. Or you can have somebody stabilize the scapula, hold there. Yeah, and then I'm just going to pull it, and that's going to distract the whole joint too. So you can palpate here. Go ahead and hold the scapula. And then you can put your hand here, somebody there, right under the acromion. You want to? Yeah, sure. Feel it right under the acromion. And then as I pull back, you feel the separation. So you're stretching the whole joint.
Yeah. Sorry, big guy.
So we'll just kind of keep rotating in circles. All right, how you guys?
Doing good.
Show you a couple of things, and then we'll keep rotating around. Hello, baby. So, we keep emphasizing the palpation, but there's a acromion right there. And then onto the humerus, the greater tubercle. So we're kind of always using these landmarks to kind of know what we're, doing. We could start with some general mobilizations to stretch the whole joint. One, there's the acromion. So what I'm looking at is here, right past the acromion. So there's the acromion. So what we should see is hold that down a little bit, just on the spine. Yeah. And then if I part the hair here, here's the joint space. We should look at this bone trying to kind of come up. So we're stretching. And that we could oscillate it a little bit. That's stretching, the whole aspect of the capsule. Or you could hold it and we can distract, and you can, if you hold the scapula and don't let it move, and you put your hand there, feel the joint space. Yep. And then I do a longitudinal distraction. You should feel that space get bigger. So that's stretching the whole capsule as well. So those are general stretches. And then if you hold the scapula again, if I do a caudal glide, what I'm doing is, see how it moves back the bone? If you feel the bone, if you want to put your finger, not on the acromion, but here, well, you can put one here and here. So there's your acromion, and then the head of the humerus. And then try to keep them on those spots. So see how that bottom finger is going to come posterior, and that's a grade 3 versus a grade 4. So you're always kind of palpating those things to kind of help you, figure out if until you get a good feel for it. So those are some ones to kind of start on. And it's hard work. Let's see. For which type of a glide? A caudal, a cranial glide? Yeah, I'm just going to come up as far as I can so that if you kind of, here's the humerus. I've got my hands here you know, you got the tricep in the way too, but if you
Yep.
kind of watch this part, you see it kind of, now stabilizing the scapula, you can see more, yeah. See now, you can actually see the head of the humerus kind of moving forward. If
So
you've
that's how
got,
you had your hand. You had one hand like this.
well, yeah,
How did
one
you-
person, if you got a second person, have them stabilize,
Yeah. If you just have it.
and then I can just, you know, move it like that. It's a lot easier for me. Or I might have been back there too, but
Yeah. Somehow you made it look really easy.
you gotta, well, yeah, but like anything, you know, it gets a lot easier quick. It's the first time you do.
And when it's a little like jerky or something like that, with one
You want
hand
me to stabilize this?
fingers trying to do this,
Say
you
that.
always use the hands.
Oh, generally always use both. Yeah, I mean, if I
Yeah. I've got the scapula.
Size.
generally not. If I have an extra hand, I'm still going to use it and feel the joint space or something. Or,
So he said put the one thumb here so that way you can kind of feel or see how your hand's moving from the joint space. Yeah. I don't know where I feel like contortion is here.
yeah, see, always, yeah, the acromion and the greater tubercle will be, or the acromion and then, you know, just go down the joint space and be on any part of the bone.
Yeah, because I can feel it.
How are you guys doing?
That makes sense. Not quite sure.
So, I mean, it looks pretty good. What I would change a little is that this whole limb was moving down like this. All we care about is, sorry,
Maggie.
the humerus, so.
Does Maggie have an issue?
No, she just doesn't want to be. We can flip them around.
We just flipped her.
She doesn't like that.
Hip extension, she doesn't like. I think that's all I remember about.
Would you say it's also easier to push than pull, or that's just
It
how I was
is,
taught?
yeah.
So if you were to be on this side pushing, as for if you're trying to do caudal, if you're just
Part of that also depends on how left-handed, like can you push
Yeah.
and pull with your left hand? Some people like their left hand is useless and some people
Very
it's
true.
okay. The technique looks good. I can't, yeah, it looks like you're getting good motion there.
And then if you're trying to do more of that, like right there.
Yeah, I mean, the problem is that you don't have a favela to put your hand on here, you just got a big beanie piece of tricep.
They will not be able to extend their shoulders because
You
everything
guys doing good?
Okay, quick rotation. Try the other side.
I'm just rotating group to group. And we'll be tired by the end of the day. We're ready for some beers. Gracie, lay down. Gracie. What's that? It's, I thought it was the other way around. So there should. I've been there. It's a pretty cool place. The little speakeasy.
Like I said, sometimes I'll break these into where we start them with massage as both a diagnostic and a therapeutic tool, right? Because if they've kind of gotten used to that, then once the bigger soft tissues, right? Because the big triceps in this area, right? The biceps, these things are kind of a little more common to think about if we're trying to like mob a hip, right? Quads, glutes, all these things that are massively holding things in place. If you don't get those to relax, it's going to be hard to get down to that tiny capsule and get it to move, right? So hi, oh, I know, big hands, right? So a lot of times what I'll work with, hi, okay, see, right? Her foot pad's pretty evenly worn down, right? To me, it's almost a 50-50 split, diagnostic and therapeutic when my hands are just getting all this sensory info, right? Making sure you trim that, because when she walks, what does she walk on? She walks on the hair. Doesn't help for stability, right? Awesome for gliding around the kitchen, but that's about it, right? But one of the ones I'll work on, so I've got thumb in her shoulder joint, and there's the top of her scapula. some of these will be really tight. And you can mobilize here. We don't have a true joint here, right? But you have an area where you can get tightness, where you can get adhesion. So when you're massaging the thoracic limb, kind of missed this a little bit in lecture, but I want try to work on, think about all the muscles that are coming down here and coming over the top to create this adhesion to allow the scapula to stay there. What keeps it there, right? We can get it a little bit tighter. These muscles, just like anything else, can get contracted. So if I can take them, and depends on the size of the dog and the size of your hands, but simply caudal border, cranial border of the scapula, bring it back and forth, allow it to move, right? So if I don't get any movement in here, right? We have old fractured ribs that have created adhesions to the soft tissue. Do we have an old scapular fracture, right? And can we, to some degree, move it cranial caudal, just loosen it up, and then that's going to allow me to come through that shoulder a little bit easier. I've come down there. You guys all are comfortable with biceps tendonitis, supraspinatus, palpating those? Perfect. Hi.
Hi.
She's like, I might need my left shoulder worked on.
We just
Just
yeah.
what we just said.
Yeah.
She's like, nah, just hang out.
I don't know if they were gonna
Cool.
go over like scapular modes too. Something good if it's restricted.
So that would be a lot of just massage along with that too.
I do them more as massage, but I've got size 8.5 gloves, right? So I can do stuff where I'm moving them back and forth a little bit. Okay, but yeah, it's a soft tissue more without having a clavicle. Right? I'm going to talk a little bit about how to do them with people. You can actually, we can mobilize my shoulder later. So it's a little bit more of a soft tissue because it's not a true joint, right? But yeah, being aware of those, because if think about how much you saw, like in the animated videos, how much the scapula is supposed to move. And if it's not, right, it's supposed to be moving with inhalation, exhalation, it's supposed to be moving forward and backward. If it's not moving, the rest of it's not going to move.
So that's an important thing to check then too before your performance dogs, to get that loosened up as well, just so they can.
Absolutely, right? Help them move a little bit. Howdy, how are you, Amadeus?
I was like, okay.
Hi, I know. What's going on, huh?
You're being mean to me.
Yeah? You're okay, bud, I know. So, anybody think that his thoracic limbs work a little harder than his pelvic limbs? Sorry, bad joke.
Everybody does it. Everybody goes there.
Right? But he's going to be a great one. He might actually, so does he have tendonitis?
Oh, I'm sure, yeah.
Yeah, he does.
And
Yeah.
he pointed out how much his spine needs to be adjusted. Feel this. I know.
So we're not talking a lot about the spine, and there's a reason why this is manual therapy 1, hint, 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 manual therapy 2 is coming. Teaser, right? And working in this area, but he kind of falls into what I was talking about with the other groups, and he's a great example for it. When you're massaging, right? Massaging the limbs, think about how, with us we have a clavicle, so it's a little bit different, but with dogs, this is literally kind of what, vacuum sealed, right? On there with muscles. So one of the ones that I look at, okay, you want to focus on the shoulder, sure, but I look at the scapula, right? I want to feel the scapula. To me, when I'm doing this, this is almost 50-50 diagnosis and treatment at the same time, right? My fingers are getting all sorts of sensory input as to what they're doing, right? So I'll take these scapulas and I'll work them back and forth. I haven't even started on the humerus yet, right? Or the shoulder joint, and I'll work them cranial to caudal, and I'll kind of get a little fancy with them, right? But I'm working on all these muscles that are holding this in place, because when he transfers all of his weight, all these muscles are constantly in tension, right? So you think about how much the scapula is supposed to move in normal ranges of motion, how much of his some of his restriction could simply be soft tissue up in here, and you can work all you want down here. But if you work on this and let this move more, it's going to translate down, okay? Hi, bud. How you been?
So you're basically, is that basically more massage than?
Yeah, it's not a true mow because there's not a joint,
there, yeah.
right? But this is more massage, right? And this is ones where I might, after I've gone through effleurage, these are ones I kind of like to really knead and move a little bit, okay? I'm not necessarily banging them, but it's almost like a grade, I'm kind of bringing it, it's almost like a grade 3 mode because I'm kind of bringing it to resistance, but it's the resistance of the muscle, right? So I was kind of bringing it around, okay? Like there's a trigger point
Yeah, he's got them.
in his infraspinatus, right?
Kind of feel it.
Yeah, let me see if I can. It's superficial, but probably right about. It's one you can't get right underneath with. Mm-hmm.
Yep.
Right?
And you make a pressure there and move and
So
your beak.
I would hold it. I start my internal clock. He may or may not exhale because he's a little stressed. Hey, bud, take a deep breath. Okay? But I may be a little more active with it. See? He's not going to like as I engage it, but I'll let up on it, and I'll bring it back again. And see if we can get him just a little more comfortable. Okay? Little steps with him, but yeah, his back. He's one that's simple to help and keep moving. Just needs the time. See, there's another one right there. Right? And that's kind of falling from supra into biceps. Hi, bud. Not surprising at all.
So you're holding it, and then you're moving the joint too to help release it even more.
I combo it because I realize, we try to teach them as individual facets, but your hands start to do more and you realize what's actually going to be a little helpful. And if I can get this to move a little bit, and what I'm feeling for is that kind of release, right? And all of a sudden, because you think about yourself, right? Things are moving, you've got a muscle tightness, you may put pressure on it, okay? But then what you're going to do, you kind of open it up, let it out. And so I'm trying to bring that for me, it's an active movement on myself. I try to bring that as a passive movement where I can't ask him to do that. So I help him to do it and see if that gets us some release. Okay? You guys good for a moment? Good? Good boy.
Does anybody want Gracie? Another dog.
That's like, it eliminates the elbow playing a role.
I get him when everybody else has told them they have elbow OA or they have Lyme disease or something like that. And I go, lame as hell. Boing! To me, it's almost a trigger point. Like I literally do that and I can get them once you load it. Yep. And then the nice part about those is to see them on ultrasound. And then most of those are right, they communicate with the joint. So by the time they get to me, triamcinolone, HA, 2 weeks of rest, right into rehab. That's what works for me. Unless they're true athletic dogs.
So now this is always tension on the capsule in a 4. With 3, it's on, off, on, off, on, off. So physiologic too. So if we're doing physiologic, just to reinforce it, stabilize the scapula, that would be a grade 3 physiologic flexion.
Okay.
Grade 4, we're just staying at the end of range. Just to kind of reinforce the concept. You're so good.
Poor nurse dude's like, oh, he's got,
That's the joint I want to stabilize, mobilize. Boom. Can take it in any direction or circles. Feel it motion.
Right.
That's it at its simplest. Then it's just figuring out what direction you want to go.
They did a study, I know, at Fort Campbell, Kentucky, and they said that among the veterans there, they found that it was like 50% improvement just by doing a basic mobilization. Even if you're not really moving a lot of stuff, but you're getting in there physiologically, they could feel an improvement.
Well, it's going to also improve synovial lubrication. It's also, sometimes if a joint's off a little, like on a millimeter or two, the surfaces aren't, and, you're kind of helping realign things. And this dog's pretty good, though.
For physiological, you would just, Maggie, you're such a sweetie.
Yeah, so for extension, if that's, the end of range, that would be a grade 3, and then a grade 4 would be there,
You just don't pop out.
instead of stretching. And this dog might like stretching more. Some don't like being held. They tolerate that a lot better because they feel the motion. So, but you'd follow.
Taking them into reflection, you would just bring.
Yeah, stabilize the scapula. So there would be grade
keep
3.
the elbow in flexion too.
Grade 3, and then a grade 4 is just staying back there. And you could do the same thing with a scapula. Like if we did upward rotation of the scapula. There's a grade 3.
Bud, can you extend your shoulder, right? So I'm going to extend it. So my other hand in massage, depending on the size of your hands, right, are going to be able to do different things. Or I'll have somebody, if I have somebody holding his head, I'm like, hey, do me a favor. Hold this back for me, and now I can really work in here real quick, right?
And does he have any trigger points that you felt when you were doing that,
Yeah.
so that we can feel them?
Oh, let's see if we can find a good one. Sometimes they're easier to...
You got
Think
something?
that one? You think that one's one?
Yeah.
Right? If I can make that radiate through. Spinal ones are a little bit easier to find. You need the big, you think about, I can find one on I feel one on me. There's one right there.
I can find them on myself, but I have more trouble finding them on them.
A lot of times when I'm finding trigger points, I will find them when they are standing or sitting. Muscles are engaged. They have to be pretty far along sometimes for me to catch them with my patients when they're recumbent.
I mean, because I can see the movement with his leg, but I'm not sure.
But like, pick like 1, 2, 3, and 4, NC State.
Has anybody not been here to UT? One person? Oh,
I've been here a couple of years ago.
okay. Everybody's been here at some point? No? Okay. 2 people.
So, I'm Dr. Drum. I am, I don't know, I guess I can't say I'm service chief any longer because they restructured our section. So I think Dr. Millis is section chief, and I'm here most of the time.
Marty's kind of the main one doing all the rehab work. That
I do all the work.
DVM, PhD from Colorado State, certified in acupuncture too and rehab, and boarded in ACVSMR. So.
Yeah, I started out equine. I have a PhD in clinical orthopedics from CSU, but I always wanted to do canine rehab because I didn't want to be an equine surgeon. And kind of that time, there was no other way to do equine sports medicine for the most part. Probably some trailblazers out there, but it's a little difficult to do equine sports medicine unless you want to purchase your own truck and all that kind of stuff. At least it was then. So I always kind of knew I wanted to do any kind of rehab. So I'm the one that actually does it all here, I guess. So,
Marty does it all.
yeah, I do zoo, exotic, equine, farm animal, you name it. My most recent unusual non-canine, I did a pig that had a shoulder arthrodesis.
Oh, okay. A little pot-bellied pig, or okay.
Really bad shoulder dysplasia.
If for people that want to set up, some people like to come for a week and do like an internship. Marty's the one to talk to about that if you ever want to spend a week. You guys, Dawn is in the class, but we haven't really said who you are either, right? And Dawn's now on the board of the American Association of Rehab Vet. Is it AARVT or what? AA.
Well, I'm the tech liaison for that, and then the APRVT is the new specialty.
That's the one I was thinking of. The American, what is it?
Physical Rehabilitation Veterinary Technicians.
That's it. That's.
Academy of Physical Rehabilitation Veterinary.
And Dawn's on the board for that, so she's a good person, especially in terms of knowing what's going on in the VT world for rehab and kind of expanding it in that world in terms of more specialization. So, Marty, do you have a case? Do you want to present a case tomorrow, or are you here tomorrow?
I'm here.
You want to do a case at 1 tomorrow for fun? Would you guys want to see one of the cases here at 1? If
I'll see what I have. Yeah.
okay,
My case
it
today.
doesn't have to be 1. We can do a different time, but.
Yeah. Let me, I don't remember who's coming tomorrow. Do I have?
Apparently I made
You can tell us in the morning what time is good too.
They're just...
Yeah, but she's not till
On
2.
We're just going to hang out.
Tomorrow's Wednesday? I can't keep my days straight.
Starts to run together.
It is.
Yeah. Well, you can let us know, in the morning what's a good time to come. If there's a good case especially a case that might be doing, some stretching or mobilization or massage, a case that would incorporate some of the things we're talking about. So, and we can, we're pretty maneuverable on our time, so. So we're going to start with, oh, you got some more models here too? We're going to go ahead and do shoulder again, just briefly, and then we'll move on to elbow, just to get a bit of a review. We've got, which dogs do we have in here? We've got one, two, okay. And that we can pull down that mat to use. So you can keep your groups or divide up. Sometimes, it's kind of good to work with different people who may have some different perspectives, feel some different things. Grab a different dog. Well, if you haven't worked with any of these dogs here, pick one that you haven't, and we'll do shoulder again to start with, and then go down to elbow and go from there. So I'm going to leave these here if I forget, so everybody knows where they are. They're not very useful to me, but all right. Let's see.
Anybody want? There's one table in there. Mat there, mat there. He's a mat, I'm a mat. That joke had to get in there somewhere. Have a pop.
Don't forget physiologic as well, scapula mobs. Just try it all. Distraction at the elbow before you glide.
And for anatomy review, medial and lateral epicondyles.
What's the, you guys are from where? Is it North Carolina? Okay.
Kind of coming
Charlotte.
down, going through the feelings of each
Which is only a
elbow.
few
These you
hour
guys will all
drive,
be
really?
good to feel their different
Another 2 to
elbows and
Raleigh
what they're
then, or
doing.
an hour and a half to Raleigh? Or?
2.5.
Oh, 2.5, wow, okay. It's that flight from Charlotte to
Go in
Raleigh is
there.
like 15 minutes, and it's amazing that, okay.
Real? Maybe? Should be. We'll see.
Hey, sweetie, you're so cute.
Hey, Pop.
Oh,
Fun.
so cute.
No.
Such a whiner.
He's blind, he has GME, IBD.
Blind too, we matched today.
Bilateral
Blankets? Yep.
patellas, and severe
Cool.
cognitive
Good
dysfunction.
job. I'm trying
Whose
to see if
dog?
you're in there at
Is
all.
it just kind of a, well, they're pretty dedicated then. All right, so we need a mat or something for you guys.
They're
right?
getting,
Oh, they're getting, she's getting. Or you
yeah,
want me
they're
to
getting
get some?
blankets.
Okay, thank you.
That good, huh? I can kind of review shoulder with you.
Yeah, whatever, just jump in and grab somebody.
GME, IBD,
Blind.
blind, cognitive dysfunction.
Living with you for how long?
How's it going?
Lay down. Put your feet towards me, towards me.
So sun?
That's
Why don't I watch you guys do shoulder, scapula, and then offer any friendly advice, but that's all, always friendly.
Everybody okay
And we
here?
could do
What's
some
going on?
needling, we got all the needles in here too, so.
Some of them might
some
do
in
that
you?
if they know it, but some of them don't.
like
So what I
needles?
like to do with them, hey pup,
those little ones are
it's
not bad.
okay. What are you doing?
Like I've just stabbed myself.
Sometimes I'll kind of cheat, and so I'll be on my knees most of the day. And what I'll do
We're
with
using
them,
16s to draw blood
so I'll
from
get them into a
people,
spot,
which, you know, 'cause we
and
get
I'll
it so
flip
quick.
Yeah.
But
and
it's a
grab
vein, it's just the skin that
their
hurts.
close
and once
limbs
it's
to
in,
me,
it's
right?
fine,
Some
but pain can-
really nice flexion with
but,
her, but feel in
Yeah,
behind.
there's always a shortage,
for
and it's
both
right by my
acute and
office. So I,
chronic
and I try to encourage the
thickening
students to do it, so I have the 3
of
LS
the joint
stickers all
there.
over my door. It's like every pint, 3 lives saved. Is
There'll be
the
a couple that
3 LS.
have bum elbows. I bet
So-
you Amadeus is cranky in his
Really?
through his elbows. But those are the
fly
ones
down.
to work gently on.
Something like that was so big and
Yeah, well, they use a 16 where I
It's a good
go.
question. You're talking about more
But, you didn't like it, yeah.
fluidity, right? If it's more acute, it almost is going to feel like a stifle flexing. It's going to be almost like
Let's
a soft
see.
tissue, right?
Is there
Whereas
anything that
the
I
reason
would,
the stifle
first thing I
stops
just get
flexing is
used
the
to a
hamstring,
chromium joint
right?
space, a chromium
So for
joint
me,
space.
if they're
Just get really used to
fluffy,
feeling,
it's going to be a little bit different.
you know, what's
because for
going
the
on
most
there
part,
in the
it's gonna be
joint
a caudal
space.
joint
chromium's going down there, flares out.
component.
That's not kind
I'm
of the
still gonna
whole key
feel
to
it
it, you
into
know,
there.
is
You
once
might
you
get a little
feel
bit of
those
spring.
things good,
But for the most part,
yeah, you know what?
unless you're finding really young dogs with coronoid disease,
Since I fly,
you're
my
going to find them
rationals
there.
I'm flying
What you're really going to find is
Friday
that
to
bony
Europe.
end feel of the chronic
giving
OA.
blood Thursday.
Okay?
Lowers my hematocrit, so, you know, less chance of a clot, so I give before I fly sometimes.
You're going to
Now,
feel,
there's probably
right?
no
So
studies that,
quick
in my
model,
head that makes
right?
sense.
radius, so we always know it's a left, although that's all Rimadyl ever made.
I haven't gotten a
left
clot
front
yet.
leg, so I do
so,
this auto,
but,
right? So come back in for
Well, my hemoglobin
And
goes
you're
up
gonna
like
pick it up
19.5.
subtly
Actually, my hematocrit and
underneath
hemoglobin
the
get
soft
higher
tissues.
than
Okay,
they
so,
should.
right,
So,
In
I mean,
through.
it's not super high,
Give me
but
just a second. See if I find.
yeah, it's because I'm so finely trained, not.
Right there. Okay.
so I'm feeling,
Right, you're right there. Yep. Okay.
How's it going?
Is that good for a minute? Let's just work through shoulder and elbow. And then make sure you flip her and work with her other elbow as well.
The other thing to just practice a lot is just go to the end of the acromion and just get really. You know, in the veterinary world, it's not really something you spend a lot of time doing. So,
Greyhound with iliopsoas?
well, like with the acromion, I mean, some dogs, you know, it's like.
It's actually one of my favorite diseases.
And it just gets a little bigger. Some it flares out more, but when you go just past it,
Feeling,
you hit
doing
this.
a little bit of joint moves
in
of
any dog,
shoulder
you're
and
going to hit
elbow.
this kind of crevice, and you're in the joint space. The greater tubercle is not very, you know, that's not a great palpable thing that the acromion is. So you have lateral distraction,
that may not be the best
longitudinal
thing today.
distraction,
Get
grade
overstimulated.
3s and 4s, cranial and caudal, scapula.
Right.
Take our time and go over the shoulder again, and then move back. We'll do elbow, but let's get the shoulder. Every time we come back in, we'll review the previous ones. My goal is that by, third. So if you can palpate in that area, then you really know if you're moving cranially, caudally, distracting, whatever. I mean, you can really feel right there the joint just distract. So
And
palpation is
finding
really a
different
big key of it.
positions. That's why I
Just really
usually do them in the
being able
middle of
to
the
feel
room
joint
because I wind up
space,
scurrying like a
feel
mouse
the bones. You kind of know where
around
they are.
them all.
Boom, there's the spine.
Even
Boom,
with
and drop.
my wingspan. It still doesn't get into a
so-
comfortable spot.
There's no
One of the ones
crime
that
in,
I
not
apologize I failed to mention,
being
I'll
that,
mention it. Everyone's we
confident
talked about
on
we're
it,
not
being
really
able
going to
just keep
mobilize
practicing it, and
to some degree the stifle.
so
But
that's kind
for
of
a
the whole
second,
key
if I
to it,
can,
though, is really knowing what
right?
you're feeling. So I mean, if you
we
know, it's like I can
diagnose
grab
the
the
stifle
acromion in the
based
head of
off
the humerus
a mobilization.
right there and do a
Think about cruciate
mobilization.
injuries.
I mean, I can
So when
make
you're
one
thinking
up
about trying to get used to
just by knowing where I
comfortably
am,
working
so.
with these, right? Your inclination's like, I need to be out here, I need to do
the
this.
movements
Just
down
think about what
here
you
in the
do
elbow,
here.
to me, it's a
Okay?
little more
When you find your four
complicated 'cause it's not
landmarks,
that
right,
much
and you're isolating the
play
stifle,
in the
testing for
elbow.
joint,
It depends
use
on
that
the angle of the
same
elbow.
concept.
So
Bring forward here, right?
once you finish the
Keep
shoulder
your hands
first,
in
and then
comfortable
go over
spots,
that
sit
again.
down on the bone.
We have time,
Okay?
so what I
And you
really
wanna
want is
because they need different things. Seeing eye dogs, stuff like that, I need them to make sure that everything flows. So every joint's on my checklist. Most of my couch potatoes, I'm like, yeah, you're pretty good, you're okay. Okay?
Here, do you like a distraction?
Yeah.
Right.
Or, yeah? You do like a distraction?
You can distract first, right? And then you want to get a little bit of, pick one and stick with it, right? You don't want to try to do both, right? You're oscillating from neutral and coming forward or neutral and coming caudally,
Cuddly?
right?
Yeah.
And sometimes I'll do them where I'll bend them a little bit. Okay? But, let's just see. Hi, kiddo. I always like to test him first. And I want to feel. It's pretty good. It's always my spot to kind of feel for joint effusion. Right? If you're kind of thinking about where,
Oh, here we go.
right?
Yeah.
So reverse it, but here's the lateral aspect of the joint, right? But one of the ones I'll do for supination is if I have dogs that have digit amputations, okay? Because then, or if their one front limb's amputated and seeing how they walk, right? Are they square on this foot or are they doing this? Are they doing this? Now I'm gonna come back,
We'll do radial owner, yeah, okay.
right?
Yeah.
So most of the dogs know, high-end competition dogs or special needs, right? Amputees, different things. Depending on how they rock, how are they going to change that a little bit and where it's going to get tight?
Weight bearing for the body, yeah.
We're not going to get them. They're not, if you've amputated a weight-bearing toe, right, they're going to do this, right? You're not going to get back, but you can work comfortably in this area and try to see if you can get a little bit that way, or if you get ones that are more medial and they're rocking out, right? So you can just have to see what each one's doing. But the fundamental ones, the cranial caudal glides, that's what I think, and then you kind of get, as you get comfortable with those, then you kind of get into the more the advanced techniques. Hi, kiddo.
I have a dog that have like sickness on the elbow that has like arthritis and everything. You do more like massage or what?
I personally do, yeah. I find, so we can talk lightly about massage. More, it's more of a soft tissue, right? And there's not a lot that really comes down. But what I'm working more is kind of active stretching. And it's almost, when you have minimal soft tissue and a joint like this, to some degree, joint mob slash diagnosis slash massage all kind of blend into one motion slash ROM slash stretching, right? So it's not one that I'm like, oh, I specifically want to do this. I start to look at it and go, she creaks here. Okay, can I get it kind of comfortably moving? Can I warm it up, right? Can I maybe, and if I get a little bit of movement in here, if I get to kind of pop and all of a sudden I can bring him up a little bit more, then I'm happy. So it's a tough one because in the real world setting, not a lot of these you're doing specific ones at certain points, which is why we focus more on craniocaudal glides at the elbow and not so much soft tissue manipulation here. Make sense? Right? Unlike equine, where we get a lot of specific diseases and injuries down here, this breed a little bit different, okay? These guys will get carpal bone fractures pretty easily, right? They'll spring off tendons, okay? That is a beautiful acupuncture point. Right, you can drop right into, you can actually feel, so gosh forbid he had Lyme disease, I can actually feel joint capsule right there, right? So you can drop right in. I know it's a little tickly, sorry. Okay, but when you're working in this area, right, you're feeling for continuity and consistency. But this is also an area where if you get mast cell tumors removed, if you get Labrador who wanted back in, this was my first year out of vet school, Labrador wanted back in through the sliding glass door, went through the sliding glass door, lacerated everything. So I had all of this was adhered. So you're just trying to, and there's not flexibility in here, right? So it was just working a lot and trying to make sure that I could get the carpus back, but there was my big problem. So feeling more in this area just for what your hands are feeling, and you're gonna pretty much apply pretty practical stuff to it. The glides are great though in here for elbow OA and for discomfort.
So you don't really massage, like trying to like elongate the tendon or anything?
I can. Yeah, I mean, if they're tight, I absolutely will. If there's a trigger point here, I find that you get more trigger points down in this area, and I'll work them through a little bit. And I just want to make sure that the tendons are happy and that they've got good stretch to them, right? For the most part, they're going to be easy to go. You may get some flexor tendon contracture in this area, but for the most part, they're pretty easy. It depends on the breed. Now, straight-legged versus Corgi, hold it, right? Shih Tzu, right? I kind of wonder how they walk some days, right? And those are ones that you can really work nicely on the soft tissue and the elbow at the same time, but they're never going to become straight-legged. You guys keep working on the shoulder a little bit. And
Or this, or the 4, or the glide. So you can see the glide pretty well. You can feel it really easily in this position. You get too flexed or extended, and
So
you
are
don't
you
feel much.
stretching the joint capsule more if you're just doing the
Well,
accessory part?
so if you just did this, you're doing both, going back and forth. So now I'm doing cranial because I'm stabilizing here, which would help with extension. Now I'm doing, see the olecranon moving back.
But I mean, if you're doing it this way versus the physiologic, are you
Oh.
stretching the capsule more?
I
I feel like it looks like you are.
think I think they're pretty similar.
Do you normally
No
do
one's ever
both, or
kind
do
of
you do one or
really,
the other?
well, that's why a lot of times you do the accessory and you follow it with the physiologic, and then you follow it with stretching, and then you do active. And
It's like
you get a little bit of
stimulating all
everything.
day.
Right? Is that good? Let's see, has anybody not started? And again, comfortable but not a death grip. You want the joint, somewhere toward the middle. If you're really extended, you don't get as much motion. You see a little bit there, but if I'm in more of a middle position, you get a lot more motion there. Okay, that would be a cranial glide. That would be a grade 3, and then a grade 4, and a caudal glide. Grade 3 versus 4. Now, if you try to do it way up here too, you don't get much either. So you want to be kind of in a middle range. You'll find some spot in there where you just feel it really moving like crazy. In fact, some people will do a general mobilization. They'll grab the distal humerus and radius ulna and just go back and forth. And you feel it in both directions pretty nicely. I don't know if you ever do that in people. You just kind of go all over the place.
Not a ton. What I saw in them is sometimes I'll do in that mid range or like the open pack, and then sometimes I'll bring them towards
Right.
their end range.
Absolutely. And
But
we haven't.
you can't go extremes.
Well, and I haven't introduced that yet because I'm still trying to be a little kind. But so if we did a physiologic extension, all right, stabilize the distal humerus, physiologic extension, grade 3. So every time we go into R2, we're stretching the cranial capsule, and then a 4. So we're staying between R1 and R2. Okay. So we're keeping the tension here the whole time. And you can put a finger there and feel it. Now here tension's off, on. Here it's on the whole time for a grade 4. All right, so it's really kind of finding the best angle for that. I think that's the main stuff there. Good. So it's very similar to what we do. I mean, it's just really more knowing their anatomy. So you guys have done like medial, lateral, epicondyle, and olecranon, muscle insertions, a joint.
Maybe, and then move to something where you feel like you're accomplishing something.
The one thing I like about starting on the shoulder is you can feel the joint space better than the elbow. For distractions and the motion, it's really hard to feel joint space in the elbow very well. So.
And then the longitudinal distraction, is that like...
Yeah, so I generally go in the angle of the bone. So if you stabilize here, you're going in that direction.
Okay.
With the angle of the radius ulna.
Okay.
Still in an open pack position.
Yeah, and then you can even distract that way and then do a glide to put some, so you put some tension on it first. So go down and then...
They're real touchy too. They're real stiff. That helps a lot, I think. Give them some joint space.
And if they are also, kind of painful, do those grade 2s for, 30 seconds, and then they kind of relax.
Well, like an arthritic elbow, is this gonna? I guess it's got. I mean, on the elbow, it's going to be a lot of that bone-on-bone stuff you talked about. So
Yeah, so
distraction.
I would do distraction, and then maybe you can do some distraction and cranial caudal back and forth. And if the joint surfaces aren't engaging, it should be fine. If they are, if it's so much
That's
over,
what I'm asking
yeah.
every time. Then it wouldn't be. But
Then it
so
wouldn't be
early on, it's
comfortable.
probably good, but later on.
Distraction you can always do, no matter how long.
Distraction is like a great one. If you just kind of distract and then have just like a gentle, just like you said, to get the synovial fluid in there, I think.
People use it all the time without thinking about it. Even like I was at the dentist not that long ago, and they like grab your cheek while they're putting the Novocaine in. It's kind of like a grade 1 or 2, So while you're putting you're feeling that instead of the. Yeah.
I do that. I ain't know about. I do. I kind of go like that and grab a dog.
Yeah,
and
yeah, it's kind of the same,
Hey, I'm doing it.
it's,
I don't even know it.
it's hard work, huh?
No.
We've had to replace a pump and but I mean that's so cheap.
You guys are in
Ours
Charlotte?
was at the University of Minnesota
Send them
too.
up to
When they got their
Raleigh
new one,
and
we
see
got
what
theirs at
I mean,
River.
that-
Yeah, they gave it to me
now you're
for
talking about
cost
a-
of moving and installation, which was
Well,
$5,000.
you don't. 10 to 4.
So perfect.
Good half hour, 40 minutes.
Emails just blowing up today.
We'll probably change about every 10 minutes. We'll change you guys through a couple of different dogs, especially since some of these are new. Oh, hi. Are you stoned or what are you doing? Are you guys going to start up at the carpus? Deal. How's your shoulder feeling? A little bit better. No better, no worse. It's a good point. I'll probably talk about it in individual groups. So much like before with the shoulder, right, where we talked about flexion, extension, and finding the right line, if you've got a valgus varus, you're going to have to find a little bit of a different plane. They're not going to be as strictly parallel, right? You have to find a little bit of an angle that you're going to tilt your body at. Mm-hmm.
I just think of all this angular limb deformity pennies. Did you see Susie in here earlier?
We've got some pretty straight-legged dogs, but we talk about valgus varus, right? Issues, much like at the shoulder where before you guys had to find the right plane, right? You're not going to bang into the acromion or the glenoid, right? With the carpus, as an example, you're going to have to find a slightly different plane if you're going to mobilize, right? You have to tilt them a little bit, tilt yourself a little bit in order to get cranial or caudal glide. If you've got, right, you're kind of opening up the one side, right? So they're going to be separation, and if you look at it in floor, there's going to be gapping of the carpal bones here and compression of the carpal bones here. So it's going to be harder to mobilize. You're not going to be able to mobilize that joint in this plane, right? You're going to have to find a slightly different plane. You're going to get more mobilization on one side and less on the other, okay?
For your clinic, like this dog that you just showed us, that tinsel,
Yeah.
do you require a radiograph of every area that you're rehab?
Sure, if they won Powerball, I'd love to, right?
So you don't make it mandatory?
I try to be practical. That dog came in with a full workup from an orthopod and a neuro, so I was already happy with stuff. And if they had said, hey, Mom and Dad looked at it and go, we can get an MRI or we can treat them. And I went,
Treat.
yeah, you know.
Yeah.
So we kind of go on presumption sometimes. I'd love to.
Sure.
University settings sometimes are a little bit different.
Right.
You know, we try to get what we can and get some reasonable info. The one thing that I'll always emphasize is that if my presumption, because I'm not always right, none of us are ever 100% right, but if my presumption is pretty much on target and my treatment plan is on target, and I'll set a reasonable goal that 2-3 weeks in we're worse, you know, gosh forbid we're worse, but if we're not improving, I'll pause and go, you know what, let's get a couple x-rays and see where we're at.
Okay.
Okay?
Yeah.
You know, kind of get a see. You have to try to judge it. I'd love to sedate them all and get everything from head to toe, but it doesn't always work out that way.
Where are you?
Upstate New York, Saratoga, Lake George area.
Oh, yeah. Okay.
So, hi kiddo. She was awesome yesterday, right? I know you snored through all your stuff. Did some filming for.
Do you ever do sedated exams for your rehab patients? Like sedated ortho exams? If you didn't get,
Every
if they
day.
didn't already have one?
It'll depend on what we're doing. I always repeat. So sometimes there's some dogs that I just can't examine awake, right?
Right.
You never want to check with David, but I prefer not to mobilize under sedation and definitely not manipulate. I have a DVM certified chiropractor in the practice, and she won't touch him at all.
Right.
She'll diagnose and feel, but she won't manipulate at all under sedation because you don't have the conscious end field to stop it, right? But I always repeat, especially in my practice where I get a lot of partial cruciates, they can be really, really tense, and all of a sudden you have them out for radiographs, and I always refeel. I always want to see again what I'm doing, and it's just good practice, right? So I always feel again, if I'm doing intra-articular injections or things like that, I'm always refeeling. It's a good point. Always try to repeat when we can.
Do a lot of like steroid lidocaine joint injections?
Steroid HA, PRP, stem cell.
Okay.
Yep.
Did you want to come over?
You feel? Something we don't see every day. Or you guys are all good?
We think so, yeah.
Pretty much making sense. Hi, Amadeus. Right? Wow. I know. Are you fed up with everybody today?
At least
no.
tomorrow I get the day off.
Seriously. Oh, bad. Wow. Wow, I thought my jokes were, that was good. No, it's true. No, I had you on it. It was just, I know. What? But shoulder, you breeze through before Sarah, makes
Sarah
sense.
showed me some of it.
You guys are
We
comfortable.
just went through it, yeah.
Shoulder, soft tissue palpation, right? Supraspinatus, biceps coming down, elbow feeling, flexor tendons, right? Easy on straight-legged dogs, chondrodystrophic, right? Or valgus varus issues. You're going to compress this area. This one's going to be naturally more open, right? I know, it's okay. So your mobilizations through that area are going to be a little bit tougher if you're not in a perfectly linear plane. And then the toes, not work him too much, but the same concept that you're applying. We'll probably talk about it more tomorrow in lecture, but the same concept that we're applying, right? It's a much smaller scale, a little bit harder maybe for my hands, but I still want to work those. I'll work them through, as part of my physical, I work them through and make sure I can bend them in each direction, right? But then in massage, I just kind of want to work them through and see that they're pretty comfortable, okay? And as far as manipulations, a little bit harder, but you can isolate them a little bit and get more, I usually get more distraction than I will necessarily get, right? Myself, we might get more physiologic flexion through them. With dogs, for the most part, I'm getting more distraction. We'll see what David thinks as he comes through, okay?
So for varus and valgus mobilization, how do you want?
Well, remember, if it's going to be valgus, you're going to have to try to find a slightly different angle. You're going to still get some cranial or caudal movement through there, but you're going to have a harder time. It's not going to be as linear, right?
Yes.
Right? So you may have to mobilize, kind of work a little bit more on one side, and you're not going to get as much to move on the other. Okay?
If you were to needle the bicep, would you go in lateral medial like this? Would you do it that way, or would you go cranial caudal?
Depends on which hat I'm wearing. Yeah. If I'm wearing my acupuncturist hat and I want it as there's a couple of points as you come down over through here, and I'll stay really superficial and I'll run the needle this way.
Oh, okay.
If I'm using it as a trigger point, I usually don't. I wind up seeing my practice, it's funny, it's more of a sports med. I wind up then ultrasounding these and injecting the whole joint, right? And letting it calm down that way. So most part, when I get a trigger point in this area, it's a big one in the triceps, and I'll drop a dry needle right into the triceps. Okay? I like to do triamcinolone and HA together, okay? Because the triam's still going to communicate into the biceps tendon because of the bursa, right? So the triamcinolone is going to get in there, and I'm going to be pretty comfortable with the HA. It may be a one-time. I may have to repeat it a couple of months down the road. I try to avoid using Depo when I can. I know there's a lot of studies. I don't disagree when we had it. But I still get some systemic side effects even from intra-articular sometimes. And I get a dog who comes in. First time I'm injecting him, I'll warn him. And I've had probably about a third of my dogs come back and go, the first 3 to 5 days, he drank like he was a fish. And I'm like, and what if we had put in Depo? And in my practice, a lot of them, I have to, more of a do as I say, don't do as I do. I have some patients that I have triamcinolone in their joints and NSAIDs in their stomachs, right? Because I'm at end stage palliative care sometimes and we're doing on top. So I'm a little bit more cavalier and I always exercise, go cautious, go slow. I can always add in more. If I get the right dog, okay, like he would probably let us do it. We shave, we block him out with lidocaine gel even. I can probably get an intra-articular into his shoulder. Elbow? No way, right? Carpus? Probably not. But I can probably get shoulder if he's pretty decent. If I had to come back with something later. So I always like to start small and go up from there. But you guys are good on mobs and soft tissue down through that area?
And needling the trigger point, you're talking about the actual when you're finding a firm
hard nodule that you're going, I am comfortable that this is not a dermal lesion, not a neoplasia, not a lymph node, not a something else, and I've got it as a trigger point as a knot, right? And I'll let it relax and release, and then if I don't get it, I like to drop I usually will do about a 1/2 inch 29 gauge, one of my acupuncture needles, pop it in there, watch it oscillate for a while, go work on something else and come back to it. And sometimes I'll twist those, okay? Because if they're kind of wound around that, I'll kind of twist one way, twist the other, see if I get a little bit of motion. And just all of a sudden, that whole thing just kind of goes. Okay? Good job, guys. Yep.
Just from extending that little bit, you see how much those flexors
How we
really
doing,
tighten
ladies?
up.
So if the dog's there,
Good deal.
or splint, and that's something you would definitely check all the way from the
Yeah,
elbow
see
all the
where
way
the
in.
tightness is.
Somebody stole them from me. Yeah, I can come back then.
The elbow
Pass
flex.
them around,
they'll
but otherwise
become loose,
I'll be
but
back in. We can do those.
You feel the tightness as you extend?
We are developing a course where I'm going to do.
Let's see, another thing we can do is if you feel the flexors,
Tape
with
and
the elbow
blades for
flexed, if you
dogs
feel the flexor
eventually, too.
muscles, loose as they can be under there.
Huh?
But now, as we
I'm doing it wherever
extend,
I told you,
you
I
feel
don't
how
get
they
these- I don't
tighten
get to
up,
make
and you
these
feel
kind of
how
decisions.
you feel them now, and then you feel how they change.
So if I
as
like
you
to
tighten.
work these right in different
You
areas,
can kind of get
okay?
appreciation for palpating where the
One of
tightness
the ones
may
I'll do
be,
is where
those
there's a lot of
tendons all the
soft
way
tissue. You have to
down.
be careful, right? If you have dogs that are easily, they're going to mat their fur, right? Dragging these kind of through are going to be a problem. But I find the right contour. This is almost like being a kid again, and which round peg fits in the right round hole. So I try to find what is going to work that one to me is not going to work.
Tired.
And sometimes it doesn't, but if I can find, let's say we had tightness and tautness
days.
here, and it's the end of your week, and you've been working
So what's
patients all
Jeff
day
is?
long,
Is
and
Jeff
your hands are really uncomfortable.
getting a new job
I
yet,
can
or
take
is he
this
kind of
and
looking
get
for
into
some?
Right?
Good.
So we want to kind of get
Did you get discouraged?
extend the carpus, get these loaded just
Not
a little
bug him
bit,
about it for a little
and
while.
I work
Yeah, I think
these,
he's doing some personal development.
taking the place of my hands through effleurage.
Keeping stuff done around the
I
house
keep in
too.
one direction, I may come back a little bit. I find when I go back and forth, I get the hair wound up in the blade. Okay?
How much pressure are you putting on it? Just do it on my.
Sure.
Family and all that.
So if I'm doing that, I kind of keep it pretty light. Right? They talk about scraping in people. Right? I start light. I'll
And then
bring
the
a
fall
little
comes
bit
and it's
down.
time to settle back down.
Okay.
There's probably some stuff
I'm
in
not bringing a
university too,
ton.
but he's probably
I can
either
bring more, right?
under or overqualified for.
To me, it's the
nothing
same
in
way I
that
do with my
sweet spot.
intra-articular injections. I start with triamcinolone. I love Depo, but most of my
Alpine
patients
Valley? Is it-
can't come off their NSAIDs,
that a
and I have
cool
to
area?
inject their joints.
Nice.
Right? So again, I'm not
Patient
always the
spot, or
helpful
is it like a?
university
have
medicine and
family
then
there?
referral practice versus what I used to do when I was in GP, but my patient selection is different now. But see how I'm kind of going through, and I add more, okay? And to some degree, I can also do these where if I have a lot of edema,
On
right?
Wisconsin is
So if
the
I've got,
Dells.
let's say lymphangiectasis,
Is it like something to do with the dad, or?
if we've got lymphangiectasia, right, and I want to hold that fluid and bring it up, I can use this to kind of keep it in place, wait a second, right, maybe find a different position, and then bring it up the leg again, okay? So to me, they're really helpful when I can do that. And then on the little dogs, sometimes my hands are just too big. My hands get in their own way on a 5-pound
We're
dog.
gonna watch a game.
Right?
He's home tonight,
So
so
I
we're
can
gonna watch a
come
game
in,
at the Hilton.
And if I've
drink
got a
some beer
really
later.
tiny leg, I'm working that
Tonight's
soft
the All-Star
tissue,
game.
Oh, really?
right?
Baseball.
Because again, I'm not trying to work on the
People
muscle
throw, a
itself.
ball and they hit it
I'm
with a
really
stick.
trying to work on
and
is somewhere between the skin
get my slides
and the muscle,
together
which is really
first,
the fascial part. And that's the whole concept that we're really working with when we talk about taping
Okay,
and blades,
so-
is working on that fascia so that
And were you up there for a time?
as a
you know?
funny,
You didn't get to go at
I'll
all?
show it tomorrow.
really,
Remind
really
me tomorrow, I'll have to put my phone to show the
Yeah,
fuzz
camping.
talk. It's a YouTube, it's a human one.
Cool.
But they talk about what
I'm
fascia
sure you're a little
actually
jealous.
sticks up.
And we have that past 180,
Yeah.
so
and
we actually have more motion caudally. It should have more. Does that make sense?
Oh, because we're going through a greater range.
Mm-hmm.
That would make sense.
Most of rehab makes sense, which is nice. Unlike some,
Well, that's why I like it,
aspects
the
of-
logic. That and neuro. Neuro is just like just follow.
but you can't see a lot in neuro. You can't like see in the brain and the spinal cord, and
You have to use your imaginoscope.
Yes.
I think neuro in dogs is better than people, because in people, so much of it is brain injury, stroke, brain tumor, central nervous system stuff that you don't even know what. It's not like you can say, oh, those neurons were affected and this pathway, and it's,
So physiologic would just be
for flexion, yeah, you'd want to have the other
Flexion.
joints flexed too, though, because if you're extended, try to do the flexion now.
it's gonna be.
Yeah, you're not going to get it all.
Yeah.
You have to have the other ones
So-
flexed.
You would bring it up here. And just
Right, and
bounce
this
it.
is obviously very normal, but
Yeah. Super loose.
and so try to do extension.
Okay.
So if it were here, then you're not going to get full. You've got to extend the other limbs.
So in this one, we would just tiny, bring it forward. And then
There you go. Yep. Who's been here 6 days? You've been here 6 days, and you've been here just a couple. Okay.
the really tired looking ones. Yeah.
No. Today it was like starting to hit. I don't know if it was. It might have been not seeing either, but it was today. It was like. Phew.
And it's harder because when you come down, like on a class example, we have knee here, and there's really just connective tissue and fascia down there. There's not really any.
So you can hit the elbow again, the shoulder again, quick, and just keep reinforcing it all.
I know you don't want to get me in your limb. Here. Let go. There we go.